Hello and welcome to Weird Careers. I'm your host, E.T. All over the world, people have jobs. And some of those jobs we don't even know exist. There are jobs that we don't know a lot about, and there are jobs that we just don't talk about. Well, I'm here to explore all of the above on this podcast. I will be interviewing people from all over the world about their strange and interesting career choices. Everything from specialized retail to sex work. Did I mention that the show was NSFW? Throughout the course of this show, we will take a deep dive into each of these professions. Think you or someone you know has a cool or interesting job? Shoot me an email at eric@cardinalimages.ca. This podcast is brought to you by Cardinal Images. Want your small business looking great at an affordable price? Email Cardinal Images at eric@cardinalimages.ca for your personalized quote. Cardinal Images, superior quality, affordable pricing, and personable photography. And today, for the first time in studio here at Weird Careers, we have Chelsea Laurin, who is a registered nurse / general surgeon.
No, I'm not.
No, you're not. I'm absolutely wrong. You're a registered nurse. Why don't you just tell us what you are?
I'm a registered nurse who works in general surgery.
I
don't actually cut people.
Okay.
That's a surgeon.
That's a surgeon. Okay, so in a nutshell, without any spoilers, what do you do?
I look after the people who've been cut open by the surgeons, and I keep them alive for them.
Oh, that's nice of you.
Yeah.
That's really nice that we have positions like that to keep people alive. That's awesome. And how long have you been doing this for?
About 5 years now. I started in 2015. I got hired onto orthopedics, so all the old people and their hips and knees, and then I moved down to general surgery.
So, like, when you say old people, like, are you talking, like, 30 and up, like, 40 and up? Because my hips are terrible.
Yeah, most people's are. My knees crack all the time. Orthopedic old is, like, anything above, like, you're talking, like, 70s to 80s. On my floor, we see people as young as, like, 16 for some surgeries.
Oh, wow.
And I take care of people who are like in their 90s. So my floor is a lot more diverse than...
I was just going to say, that's quite diverse.
Yeah. 16 is the youngest, but...
16, wow. And are you allowed to tell me what that issue was at 16 years old?
So 16 years old, they usually just come in for special procedures revolving the jaw. So my floor specifically, we have like 8 to 9 different services that we deal with. So I say general surgery as like, but we're basically like a catch-all for everything.
Okay.
So we have like general surgery. So if you have like gut issues, if you have colon cancer, if you have like anything with like Crohn's disease or anything intestinal, if you have like pancreatic cancer, if you have appendicitis and you need your appendix out or your gallbladder out, we do those, as well as we do some plastic surgery.
Jeepers.
We do some urology surgery, so old men with their enlarged prostates we see all the time.
Oh, lovely.
Yeah.
Wonderful.
And the young ones usually come in for dental surgery, so like your classic 16-year-old who needs their wisdom teeth cut out, and then they need like their whole jaw like cut and brought forward. Those are the 16 years. Yeah.
One of my friends just had her 2 wisdom teeth taken out, and the snap I got after that was just prizes. I got all this gauze in my mouth. I can't see. Yeah. I can't really talk right now. It's just, and I'm sitting there laughing my ass off.
And that was probably just like your regular wisdom teeth. This is like wisdom teeth on steroids, because they actually like cut your whole bottom jaw and then bring it forward.
My God.
Their mouth is full of like wires and braces. They can barely talk. They're on like a liquid diet for like 3 weeks. It's really intense, but they're generally like pretty good for 16. I usually give them props for that. That's the youngest, and it's only for those procedures. Other than that, we're like 18 and plus.
Wow. So tell me, like, what does it mean to be a registered nurse? Actually, we just went through that, so I don't really have to ask that question anymore. Scrap that. Is there an average day in your field?
No.
No.
Not at all.
Not at all. So what time do you start in the morning?
I start at I work 12-hour shifts, so we do 7 a.m. to 7 p.m. But quite often, a lot of us are in there at least like 20 to 30 minutes beforehand looking up our patients, and we're there sometimes much later than that.
Yes. My wife is works at the hospital in London, so I totally 7 to 7 and staying late.
Yes. So there's no real average day, because one day you can get like one of our regular patients, and then the next day it'll be someone completely that we're not familiar with, or a surgery I've never even heard of. Mm-hmm. COVID right now has put a lot of those surgeries on hold. Oh, yeah, I bet. But there's definitely no average day, other than we start with 3 to 4 patients, and hopefully we end with that.
Let's keep it that way. Let's not increase the number of patients.
Unless it's expected, then one can go. But other than that, I usually say I've had a good day if everyone's alive by the end of my 12-hour shift.
That's normally a good way to judge your day. If everybody's alive, that's great.
Especially if they're really fucking annoying. I'm like, but did you die?
No,
so
you're great.
I get my 12-hour pay, and we're good to go. I'll see you tomorrow.
So what kind of schooling did you need to do for all this? And what was that like?
So for me, for registered nursing, I actually went the kind of long way around. I did my personal support worker training first so that I could pay for school, because it's 4 years of like a college university education, and that is quite pricey.
Oh, yeah.
So I did butt wiping on the side, and then and then I did 4 years of. I actually went to school here, Fanshawe, and then did first 2 years at Fanshawe, second 2 years at Western. And then, it was really hard. It was, when they say like, oh, it's not going to be easy in college. It's like, no, it's not very easy. The pharmacology course like kicked my ass so hard.
And that's drugs, right?
That's drugs. Yeah,
okay.
I was very happy to pass with whatever grade I got. It was intense, and a lot of the science courses were pretty hefty. I'm like, I don't use half of the stuff I learned in school. I'm just glad that I made it through, because it was tough.
So how long was that course then?
The pharmacology course, or in general?
Just in general. How long were you in school for?
I was in school for 4 years. So in those 4 years, we also did like clinical placements as well. Now the program has changed even since I went in, because we were doing clinical placements throughout. I know now the program changed after me, so I think they do less like clinical placements, but there are other ways. Like one of the girls I work with, she did compressed time frame. So as long as you do like a couple years of university schooling, you can actually compress that 4 years into 2 years, which is actually how a lot of people get into it. They either take like kinesiology, which you can do nothing with.
Yeah.
It's like one of those bum courses like, I got a degree, and then it's like, oh shit, I can't do anything with it. Might as well go into nursing. So at least you don't have to do all 4 years, and it's a lot like quicker that way. So they shove all those 4 years into 2 years.
Oh God.
So it seems a lot, right?
No, thank you.
I'm like, absolutely fucking not. Would I do that?
No, fuck that shit. No. Ugh.
She's like, I couldn't have pictured it any other way. And I'm like, I could. 4 years. I'm done.
Let's slow that shit down, please.
Exactly. I'm like, I need time to digest everything I just learned and then throw it out, because I won't ever need it again.
Exactly, right?
People think you need a lot of math. I'm like, dude, I barely know how to do anything. And I'm like, the only time I have to count is sometimes with the drugs. And then I ask everyone, okay, did I do this right? Like 1 plus this plus that equals, I think that's right. Okay, we'll just give them a little extra. It's fine.
Remember when they said in school that you would never have a calculator in your back pocket?
Oh. Right? How garbage is that?
Hey, check that out. It's in my back pocket every day, Mrs. Pankhurst.
And that's the other thing too. I'm like, now all of our charting is online too, so I don't even have to use a calculator. The computer does it for me.
That's hilarious.
right?
It's so funny how how it's changed so fast. Like
Yes.
you really don't think, oh, no, I'll have a calculator. Now, kids now, like a lot of the younger people that could be listening to this podcast that have had phones.
Yes.
So, they've always had a calculator in your back pocket. Now, kids, I'm going to call you kids because I know some of you in your 20s, but I'm going to be 31 soon, so I have the right to call you kids. Kids, we didn't have a calculator in our back pocket when we were in school. So we literally had to learn how to do this math. Because they're like, you're never going to have a calculator in your back pocket.
Long division? Does long division even exist anymore?
Quick Google search tells me no. I think it's right beside King Tut and Caesar, yes. Yeah, and cursive writing was actually just reintroduced into the school system.
Really? Because they got rid of it for a while, right?
Yeah, it was reintroduced. And then I got really sad about that.
I don't like cursive writing.
Well, I like it, but I'm sad they brought it back because now I can't send secret messages to all my friends. And my kids will never understand what it means. But now they will.
God
damn it. Anyways, back to actually what we're talking about here. What was something that you didn't expect to encounter when you entered the field, or did you feel you were fairly prepared?
I don't think you could ever be prepared for this kind of profession, in all honesty. You learn a lot and they do their best, but I don't think anything could prepare you for putting like your finger up an 80-year-old lady's bum, right? Like, nothing can really prepare you for that. Or like half the stuff that I see in a day, like you can learn a lot. It's like, oh, in a book, it's one thing, but when you're actually there experiencing someone vomiting and you're like, right beside you, it's like it's a little different.
That's the one thing I can't do. I can't do vomit. I can't do that. That's the one thing. I'm fine, but vomit, no.
Secretions for me. I'm like, if anyone's like, I'm trying to get report and there's an old man who's like doing that old man nasty like horking, drives me bananas. I literally close the door and I'm like, you're gonna have to stop talking to me. I literally cannot focus. If we have people who have like tracheotomy, so like in those like adventure action movies where people like shove the pens in their throat to make them breathe. Okay. Which never is actually how it's supposed to be done. But of course. I digress. That's why I can't watch Grey's Anatomy. It drives me off the fucking wall. It drives me up the wall. I'm like, I've never had a doctor walk my patient, but okay. Never ever.
Oh, the things we can say about doctors.
Right? Like,
I've heard the stories. I've heard the stories.
It's unreal. I know.
That's a whole nother show.
Exactly. I could go on. But yeah, like the stuff like when they can't actually put it through their mouth and it's just coming out of here, I'm like, huh.
Oh yeah, that would. Oh God. Yeah, that would get me too.
I have had people literally shit in my hands. It does not bother me. I'm like, as long as I have gloves, I'm like, all right, it's a Tuesday, whatever. As soon as you start like horking at me or giving me a Kleenex that has all your mucus in, I'm like, get that the fuck away from me. I don't want anything to do with it. So like, you can't really be prepared, but at least I feel more prepared with the schooling I got than these poor kids nowadays. They're like, I feel like they're getting shafted, but that's just
what makes you say that?
They're not coming in with as much like in-person experience. And I think the way the program is going, it's going a lot more with the administrative route where they're trying to push a lot of like the new grads into like either research or administrative stuff and not as bedside as it used to be. Whereas my education was like, okay, we're going to learn the skills. You're going to know how to wash people. Whereas now, like, they're learning those things, but it's literally like, if you and I were in the program, it's like, okay, pretend to bathe each other versus like, I had to go and actually bathe people in a clinical setting. Mm-hmm. So. And
that seems like it's a better experience in general.
I feel like it shows you what that aspect of nursing can be before like you get too far in. Because I did that my first year. Granted, I already did like the personal support worker, so I already had an idea of what that would be like. Mm-hmm. But I know a lot of people dropped out in our first year because they're like, I don't want to do this. Yeah. Which it's a part of it. And obviously nursing is so great in the fact that it is so broad and you can do so many different things. Like I'm a bedside nurse. I probably will be for however long my career is, but I cannot see myself going into policy or anything like that. But you can do public health, like especially with everything going on right now with COVID, like they are doing so much for us, and I appreciate all the public health nursing that they do right now. And there's policy, so like people instituting those changes that we see on my end of things. So people higher up recognizing changes that need to be made in the hospital with nursing care trickle down to me, and then I implement that. But I'm not the one that introduces those policies. So there's a wide range of what our job can be. So the schooling today isn't as focused on the skill based, because that's going more, I feel anyway, to like the registered practical nurses, so RPNs.
Yep.
So they're getting to be more task oriented based, whereas we're more, because I'm just a registered nurse.
Okay.
So I get more like of the administrative stuff. So a lot of I can say kids because they're coming out of school at like 20, and they're like, what? And I tell them, I'm like, okay, we're gonna do this really basic dressing, and they're like, like eyes wide, Bambi, like I'm like, okay, can you like wash this person up for the day? They're like, what? Okay. And I'm like, and then they look at you. I'm like, have you washed a person? They're like, what? I'm like, how do you wash yourself? Do that to another person.
I feel like that's just common sense.
You'd think, but I think it's the mix of like being at placement and like having like the initial nerves. But
okay,
like,
kids, this is your advice from yours truly, ET. If you don't know how to bathe somebody, get yourself a girlfriend or a boyfriend. Have a shower with them.
Or a willing person.
Or just a willing person. You know, we don't have to put labels on anything. Get somebody who's willing. And just just make sure you don't do the fun stuff with the patients, because they don't like that.
No.
Apparently there's a lawsuit involved.
HR, that's the whole thing.
But at least learn how to wash somebody else, because they'll at least tell you. They'll at least, ow, that hurts. They'll at least tell you that part. So get yourself somebody. If you don't know how to do it to somebody else, get yourself a person.
Yeah.
Craigslist. I'm sure there's Tinder and Grindr, whatever is there one for I know that there's Grindr is for gay men, but is there other ones?
I don't know, but I'm sure
asking the wrong person.
Yep, probably. That's beyond me. But I'm sure that'd be an interesting post. Be like, oh, hi, my name's Becky, looking for someone to bathe, and then they could you imagine someone expecting
there needs to be an app just for that now.
Just for that, just for like clinical like skills. Be like, I need a willing participant to try to put in a catheter. Who's offering? I will try.
How much money?
Yeah, right. That would be the only way. I've offered it to, he's like, absolutely not. My husband's like, no, do not touch me with that. He's let me put an IV in. That's the closest medical thing he's let me do.
Yeah, I wouldn't let my wife put a catheter in me either.
No, it's not one of the fun ones.
No, absolutely not. You kind of answered that one. That's another one you kind of answered. Because it kind of does. So you want to be bedside.
Yeah, probably.
So, and something you said earlier in the interview, and it kind of made me wonder, like, some people they get into their first year and it's like, this is not what I want to do.
Yeah.
How did you know this is what you wanted to do?
I had an idea earlier on. My mom has always worked in healthcare as far as I know. And, well, she did like Loblaws. Like,
shout out to Sherry.
Yeah. Hi, Mom. So she's always been in some kind of healthcare, and other than like the politics of any workplace, like she's always enjoyed spending time with the residents, and I like talking. So
you don't say,
right? I will. I could probably talk for a while.
Oh, good.
Yeah. But and I always love the science aspect of what nursing involves, because it's not just so much like, oh, sure, like holding someone's hand or whatever, but it's also like, oh, I get to see many things that not every woman could say that they've seen. Like I have seen a man's beating heart beat through their chest because of a surgery that they had.
Damn.
Yeah, and it was very intense, and then I'm entrusted to care for that person. So it's a very, very vulnerable place to be, which is not the spot that I was looking for, but it definitely melds those two areas of my life that in a way that I can feel productive. So I can get the sciencey stuff, and I love explaining that to like the new hires or students that we get, like the science behind it. But I also like talking to people and developing that relationship, which is why I also couldn't do like OR or anything like that, because
That's in and out.
they're sleeping the entire time. So people who are very like antisocial or just
I know a few of
introverted,
them.
and if you want to go into nursing, like OR might be the place for you, because
Okay.
other than saying hello, what's your name, what are you here for, then they're out.
Yep, exactly.
And that's it. And then you hand them off when they're still out. Versus I have to see them when they're awake and talking and yelling and screaming. But also being polite little Betties who I would kill for because they're the most adorable old ladies in the world. So it definitely meshes those two worlds for me. And granted, it's a lot more than you originally. Everything's like rose-colored glasses when you first go into any career. But,
Of course.
So they're a bit more lighter than they
Yeah.
were before, but it's still at least getting that fix for me, I guess you could
That's
say.
awesome.
Yeah.
So we're just going to take a quick break right now just to have a very brief word from our sponsors. We will be right back. Hang in there.
Are you a small business owner? Having a hard time marketing your product during these difficult times? Not to worry. With Cardinal Images' affordable pricing and superior quality, you will be able to show off your products better than ever before. If you're a listener of this podcast, you get not only your demo images, but also your first set free. To get this amazing deal, email Eric at cardinalimages.ca with the subject line podcast promo to claim your free shoot. Cardinal Images, superior quality, affordable pricing, and personable photography.
And welcome back to Weird Careers. We're here with Chelsea Laurin. If you're just listening now, which I don't even know how that's even possible, unless you just randomly decide to skip to halfway through the show, you already know Chelsea. So, I'm looking at this is a really good one to come back to. And we were just talking about this off the air, which is quite fun. So I'm guessing that you would definitely need a strong stomach for this job.
Yes.
You would definitely, you would agree with
Yeah.
that. Okay. What's the queasiest thing that's happened to you?
And
I use queasy in quotes.
Yeah. It's an everyday occurrence every time I'm at work. There's a lot of butt stuff.
Oh my.
Yeah. Intentional, not intentional. There's blood, guts, and sometimes guts, mostly blood,
Ugh.
mostly poop.
Yep.
You see it all. Probably one of the most, not the most, the most queasy that we do a lot of the time. We do a lot of enemas, specifically with a medication, and it's very sticky, so it gets everywhere, and you just hope you have enough pads underneath to catch it. Yeah, it smells
my God.
rank. It's not the most fun thing,
geez.
but bless, I love my coworkers. That's the best part of my job. We are very much a
Oh, you'd have to have good coworkers for that.
shout out to 8th floor. All my good friends
LHSC,
at
8th floor.
Yeah.
At university?
AIP, my gals. Yeah,
University Hospital.
we are very much a group that as soon as a lactulose enema is on the table, you're like, all right, who's gotten up? Who's coming? Come on, guys, let's go.
That's
Yeah,
fucking great.
a lot. I've had someone poop in my hands, actually.
Pardon my pun, but are you shitting me?
No, not at all.
Fuck.
It can be. I've seen red poo. I've seen really black poo.
I'm really glad that I haven't eaten yet.
Yeah, right? My stories don't go over very well at family dinners.
So we will make sure that we will put a disclaimer in this particular
Yes,
episode.
yeah.
Make sure you have not eaten or are not currently eating unless you have a strong stomach, because this one gets graphic.
It's something I'm now well versed in, but
Yeah.
it's definitely not good stories.
Which is why it's a weird career.
Yeah.
Because there's stories, not every single day is a different day.
Yes.
You have no idea what you're coming into.
No.
Literally no idea what
No.
you're coming into. You're coming in and you're like, okay, how is my day going to get fucked up today?
And
Right?
yeah, that's why I'm like, when you asked me to do this, I'm like, well, I'm a nurse. Like, it's not really weird. And then I saw that question. I'm like, well,
Right?
we did have a patient not too long ago, air quotes, fall onto a plunger rectally. So they had to have surgery. So I'm
sure it was an accident.
Right? I'm like, I don't know how you slip and fall onto a plunger, but that's as much as I can say. And I'm like, well,
I think somebody was a little curious.
yeah, hopefully,
to say the least.
hopefully things healed well. That's all I gotta say about that.
Please
but
tell me it wasn't a wooden plunger.
I have no idea.
Because if it was wood, splinters.
Yeah, it's a
Oh!
thing. Yeah,
Ugh!
we've had someone perf
There's a
their
reason that
bowel.
sex toys are not made out of wood.
That happens a lot. They come in foreign body and rectum. That's quite an often.
You were saying off the air something about a spray can.
Oh yeah, that was a couple years ago. But we had a patient who thought it was a good idea to cure their constipation by putting one of those aerosol deodorant cans up their rectum.
Oh, for fuck's sake.
Kept it there for almost a month. Yeah. You can see it on
Curing it.
with something. Yeah.
Okay.
Don't recommend, as a healthcare professional, don't recommend that whatsoever.
Yeah, no shit.
But you
Oh
can.
my god, literally, no shit.
Yeah, you
know shit for days.
you think you've seen it all, and then you actually see the endoscopy photos, and then you're like, oh no, shit, that's a can. Yeah, that's a can
My
up there.
God.
Yeah,
My god, that's...
you get the dildos are nothing. You see that all the time.
You get dildos, the people with dildos stuck.
I've had a patient admitted once with that, but if you like in Emerge, it happens a lot in Emerge. They only come to me because the guy had to almost have surgery. They had to put him under anesthetic to get it out.
Oh my god.
Yeah, that was fun.
There's I watched shout out to the podcast Sex with Emily, because her number one advice is there is never enough lube. Remember that, folks. So if something's not going in right, chances are it's not going to come out nicely either.
No.
Make sure you use lube.
Yeah.
This message has been brought to you in part by Common Sense. That's, oh my God, people.
Yeah.
Like, has your faith in humanity, like common sense, just died at this point?
It's hard not to talk when you get those people in. Like I've very much been facilitated the talk where I'm like, I may not have that patient, but I'm like, oh my God, what you gotta tell me, like, what's going on? Like we've had a lot, and I'm like, what was it like? How did it happen? That's like the number one. Okay, you see what their diagnosis is, and then you're like, all right, Tina, what the hell? Like, what the fuck happened? How did this event occur? They're like, well,
what's their story, and what do you think actually happened?
Yeah, exactly. It's like, okay, off the books now. Like, what actually happened, though? It's very much like that kind of thing.
He really didn't slip onto that plunger. He told me that story, and then he asked me out, and I said no. So the queasiest thing, like you would say, is...
But see, that stuff doesn't even bother me, honestly.
So I guess that's a weird question to ask you. So, that's a hard one to figure, because you don't find it queasy.
I don't,
because it's just your regular 9 to 5.
And
7 to 7, I
especially
guess.
with the floor that I'm on, because with general surgery, we do a lot of, like, bowel surgery. So we make ostomies. So I don't know if you're familiar, but if people have colon cancer and they need part of their bowel cut out, sometimes
Ouch.
they'll have, like, those little bags.
Yes.
Yeah, ostomy
Yes.
bags. So
Yes.
we do a lot of those surgeries. And the problem with ostomies is that they're fucking rank.
I bet.
You underestimate like how much that extra bowel that you have and it going through internally through your system versus like just coming externally. Like you think sometimes poop in the toilet smells bad, coming out of a bag is a lot worse. So there's a few times where new residents or new doctors will come onto our floor, or they'll just be consulting and they'll be like, oh my God, what's that smell? I'm like, oh, welcome to our floor. That is just us. It's an all-time thing. Don't worry about it. You'll get used to it, or you won't be
Jesus.
long enough to, like, you won't be here long enough to, like, worry about it.
Oh, that's funny.
So, like, that's the thing. Like, that stuff doesn't, like, make me queasy or weird me out. If I find it interesting, like, a lot of the dressings that we do are very, like, can make people queasy. Like, we've had students, like, nearly pass out. I'm like, go stand against the wall. Don't be in my way. Like the hard thing, a guy had necrotizing fasciitis, which is basically like flesh-eating disease.
Ugh.
PSA, people wash your bits. Like, it's, yeah. I've done a dressing into a person's, well, I can say a man because it's a man's scrotum before because they weren't washing properly.
Oh my God.
Yeah.
Wash your junk, man.
Yeah, wash.
Seriously, wash your junk.
Just everybody wash.
Everybody.
And
Ladies,
if something looks weird,
wash. Men, wash.
People,
Actually,
wash.
let's just do it this is the easiest way to divide this. Penis owners, wash. Vulva owners, wash. Done.
Everybody, and then everyone wash your boobs. Just everyone.
Wash your titties. Yeah. Wash them titties. They need the love too.
Everything.
You know how much men you know what? And if you've got somebody in your life, get them to wash the titties. Cuz they'll enjoy it.
Yeah.
And trust me, they'll get washed right. They will get washed thoroughly.
We've had plenty of people come in because they did not wash properly and had to have surgery. It's a weird
surgery.
Thought, yeah.
Oh my God.
Yeah.
Oh my God.
But that stuff doesn't bother me anymore. So it's weird. Like we said, the mucus stuff, that's probably like the queasiest part for me anyway.
Yeah.
But a lot of people I know, they can't stand blood and guts and like necrotizing fasciitis. They had to like basically from start to finish of the person like being recognized that's what they had in surgery. They amputated his arm, cut away most of his chest so that I was doing a dressing and I was basically shoving my hand underneath his rib cage.
Oh my God.
Yeah.
Oh my God.
I know, right?
Ugh.
But that's like also kind of like, oh my God.
For you,
I get to do this.
And then we're just like, oh my God. And you're like, oh my God.
Yeah, but I'm like, what?
If you could see her face right now, this is like total excitement.
I
for
know.
Her. Oh my God, I get to stick my hand in someone's rib cage. This is great. And we're like, oh my God, you have to stick your hand in someone's rib cage.
But it's fun.
Jeez. Wow.
Yeah.
Damn.
Even vomit's a thing on our floor all the time.
Yeah, that's the one thing I can't do.
Oh.
I can't do vomit. I can't do vomit.
I was this close to being covered in projectile vomit like 2 weeks ago.
No,
it was intense.
No, thank you. Oh, God. Now, a question I actually didn't write down, and I'm actually really surprised because this is a question I ask everybody. Mm-hmm. The COVID-19 pandemic has changed everything, has changed the world as we know it, has changed literally everything we do in our lives. This is the first in-person interview that we've had because of COVID-19. Mm-hmm. Again, I want to thank you so much for actually being here. This is fantastic. It's also great to catch up. For those who don't know, Chelsea and I have been friends for 20 years?
Yeah,
give or take.
Age.
Pretty much, yeah. So it's nice to actually have somebody in the studio to banter with. Because, I mean, it's easy to banter on Zoom, but there's a delay. Right? So, like, I feel like I'm cutting people off, and it feels really awkward.
And I live out of town, so it'd be like
that'd be
a
awful.
2-hour interview.
Exactly. So COVID-19 has impacted everything, right down to media and the arts. Mm-hmm. But you're frontline.
Yeah.
You are frontline. You are right there when everything was going on. Mm-hmm. How did the COVID-19 pandemic affect you and what you do?
Me personally, it was a big mental health struggle.
Tell us.
In the time, like last year when everything was going on, just me personally, I was also planning my wedding. So
what a great time to plan your wedding.
Right? It ended up working out. Rings on, so we're good. If anyone's wondering, nothing, it wasn't
I can confirm.
Yeah.
It is there.
But having to deal with that, and I'm not a person that does very well with no direction. Okay. So like I love things being in black and white, and that is very much why I'm also in this career. Like I hated philosophy in high school. Like it drove me nuts. Mm-hmm. So the problem, especially last year, was it was a lot of like, we're going to do this. And then I'd be like, well, why are we doing this? And they'd be like, well, it's coming down from up above, so we have to do it. And there was no real direction. Mm-hmm. So that mixed with stuff in my personal life and trying to plan a wedding, like it all kind of snowballed, and it was really hard, and it's really isolating because we go from a profession where it is very much like a face-to-face, day-to-day, like I will rub your back when you're throwing up. If you are a palliative patient, so if you're actively dying, and I am washing you and that kind of thing. Whereas now we have to wear these masks all the time, which I understand, patients understand, but it definitely takes away that humanity piece of it in a way. And let alone like the population we have to deal with, where if they can't hear on a good day, now I have to add a mask to it. So it just makes that communication piece that much harder.
And for people like my wife has a hearing disability. So a lot of the times if she can't hear somebody, she relies on reading lips.
Yeah.
And in this situation, she can't do that. She has to ask people to speak up.
Yeah.
Because they don't have, like, luckily right here we're 6 feet apart. Mm-hmm. You have both your shots.
Yep.
Congratulations. That's fantastic. My next one's in September. So I feel like we're pretty safe where we are. This is pretty awesome. And we couldn't do this 2 months ago. We couldn't do this 3 months ago. We couldn't do this. And it's nice. This is great. But back to your job. So you were on the front lines.
Yes.
Like were you right there?
Not specifically.
Okay.
The hospital did I will say, of the things that everything happened, the good thing that they did was trying to separate a lot of like the COVID potentials. I think between last year and even up to now, we've probably only had maybe 2 or 3 positive COVID patients on our actual floor. Emerge doing an outstanding job of actually like screening people, and they automatically do like the swabbing downstairs before they even come up to us. So we don't specifically deal with COVID patients, which is also why I feel a bit more safe. Like we don't have
Awesome. Yeah.
We don't have that same kind of interaction with them. Although of course right now like we're cleared now, but there was an incident where one of the staff came back positive. So instantly we shut surgeries down and only do emergency surgeries that need to be done right then and there. But a lot of like the scheduled surgeries, they'll push back. And I think that's been the hardest point with COVID for our floor specifically, is the fact that sure, we're not really dealing with COVID positive or COVID patients, but it's the fact that because everything has been so delayed, we're getting people where they may have been diagnosed like stage 2 or 3 cancer, and now because of delays, they're coming in stage 4.
Yeah.
And that's the harder part of our job, and my job specifically, is that now these people are coming in way sicker and needing way more care than they would have should these delays not have happened. And that's the hard part. It just adds like that extra layer to a lot of it. So
have you seen you've seen COVID patients? You've seen what that looks like?
Not super up close, but a lot of the down in the ICU, so the intensive care unit, that is where they all are. I do not work there. I bless my lucky stars every day. I don't work down there right now. But no, so we've had one, and it was scary because it was maybe a month or 2 into everything happening, and the patient was like same age as you or me, like early 30s, and like 1 minute they were told like, oh no, it's probably just a cold, and then the next thing they're coming in and their lungs were white on an x-ray. And if you're not familiar, a chest x-ray, lungs should be relatively clear because it represents the air going in. So there was white, like they call it like white out because of the infection and everything.
Wow.
And I remember I didn't have to take care of that patient, but I remember the doctor coming in and saying like the patient was on a lot of oxygen, and they were as high as they could go on the oxygen for their floor, for our floor, because we can't intubate people on our floor. So if they need like a breathing tube put in, we can't do that where I work. Okay. So they would have to go down to ICU, and that was basically where the patient was at. And they're like, we have to see how this night goes. And if you don't improve, the next step is you going down to the ICU and you're intubated, and we don't know where you're going to end up. Jeez. Got better. Went home, thankfully, but that's scary, and especially in the start of all of that, that was as close as I've been to anything like that, and it was scary.
But needless to say, this is real.
Yes.
So for those people who still think this is a hoax, like this is real. This COVID-19 pandemic is not some made up hoo-ha. Get your vaccine.
Yeah.
Please. You want to return to some kind of normalcy. We're never going to be back to what we were.
No.
That will never. There's the reason why this, pardon me, this is not, I swear this is not COVID cough. This is, this is stoner cough, okay? I work at a dispensary. What do you expect? But, shit. What was I saying? Stoner problems.
COVID? Vaccine?
Get your vaccines. We'll just start from there again. Get your vaccines. Like, just get them. This isn't a hoax. Like I was saying, this is not a hoax. Get this. This is real. This is happening in your faces. No, my cell phone did not get better reception when I got my first dose. That is not a thing.
No.
If in fact, it might have gotten a little bit worse.
And there's people down in IC right now in their 30s who are positive.
Yeah.
Like at my hospital.
You're hearing that.
Yeah.
People hear this. Hear this. You think that it's just the old people that are affected by COVID-19. There are variants coming around that are specifically targeting younger people. Please be safe. Or else stuff like this, being in-person interviews, can't happen anymore. It's really for everybody's benefit. So let's just keep that in mind. So moving forward, we're getting right down to the nitty-gritty. I ask everybody these questions, and we try to do these ones as quick as we can. So
Okay.
These ones are don't think, just answer.
I'll try not to talk too much.
Oh, it's not that. It's don't think about your answer.
Okay.
Just say it. Don't think. Just say what comes out. What's the best
Okay.
part of your job?
My coworkers.
Why?
I would not be able to do my job without them. 100%. They keep me light. I love nothing more than taking their minds off things and I'm very much a jokester at work kind of thing. Not like prank, I just try to make people laugh because our job can be so draining mentally and physically. And I would just not be who I am or have the work, skill base with the senior nurses or the relationships I have with my coworkers is some of the strongest relationships I have. I would trust them in a heartbeat. If someone's going down, I would want no one else behind me other than the people I work with.
That is a very common thing that I'm hearing as I'm doing this podcast. That seems to be a common theme is coworkers.
Yeah.
I can attest to that too. Being in a place where you're with these people 5 days a week. That you could get sick of them, but why? Be a family. You're there together. You have each other's backs. That's what it should be. And hearing a lot of these intricate different careers, that's not, I work at Walmart as a greeter. It seems that you have that aspect. You have that family community, I guess is what I'm trying to say, which is that type of community feeling. And that's a wonderful, wonderful feeling.
Especially during all of this where we
course.
can't go anywhere. So literally other than my husband and my pets at home.
Exactly.
My coworkers are my community and my family. And I know a lot of people working from home. You hear, oh, I just work from home. It's like, oh, but it's so... And then I'm like, why are you complaining? But I also realize I'm like, oh, but I get to socially interact.
Get to leave the house.
I get to leave the house.
Exactly.
I get to spend time. And I have no problem saying that many of my coworkers are actually my friends.
Yeah.
And I would be nothing. If a patient is dying on the table, I would want nothing more than I'm like, it's life and death. And I know that they would be there and help me out and help that patient.
Now, if there was something you could change about being a nurse, what would it be and why?
Loaded question.
I had a feeling this wasn't going to be a small one.
No. What can I change? Probably the workload. Probably.
Yeah.
I know it's easy to hear you have 5 days off because I work 2 day shifts, 2 night shifts, and then I'm off for 5. But I'm like, those days that I work, I am there 7 a.m., 7 p.m., like we said, sometimes longer, sometimes earlier.
Yeah.
and I can potentially, I've also been starting to get put in charge now more often.
That's awesome.
It has its moments. Like last weekend we were super short. We did not have the staff, and it's a difficult job to be in, and also, which every job is difficult when you're short staffed. But
Of course.
when people and patients rely on you, it's hard to take that not to heart when you can't provide them the care that people deserve. Because unlike greeting people at Walmart or stuff like that, like, sure, if I don't get said hello, I'm like, oh, well, you're a bit of a prick, but all right. If I don't give someone their pain meds, or if I forget to do something, like, it can have dramatic consequences.
Exactly.
And with my line of work, it's getting to be where many people, especially on my floor, which is every floor, just the staff coming in is not enough for the need and the demand that we're having. And people are only going to get sicker and sicker, especially what we were saying with them having to delay everything now.
Exactly, yeah.
It's only going to get worse. So if I could change just the staff coming in, like, we just need more. And I know that we keep trying to push for acute care to, like, dwindle and move more towards community, but even as a nurse, like, we just need more of them.
Yeah.
we just do. It's community wherever, in the hospital, in people's homes, wherever you work, we just need more of you. Basically, is what it all boils down to. There's so many. The one thing I always say about my job is that I will never not have a job as a nurse.
Oh, absolutely, yes.
Death, taxes, and I'm like, there's always going to be someone sick, so I'm always going to have a job, which means
unless we become androids but then we have computer viruses.
True. Which I couldn't help with, unfortunately. I'm rubbish with computers. So other than internet, I'm garbage. But yeah, everyone's going to be sick. So it's not a career that's going to go to the wayside anytime soon.
Awesome. And do you have any advice for anyone who wants to become a nurse?
Don't do it. No, I'm just kidding. After I just said we need more.
We need more people. But don't do it. Please don't. God, don't do it. But we need more of you.
But we need more of you. But also, please just, like, think about what you're doing. Any advice? Just make sure you're in it for the right reasons.
Yeah.
It's very easy to say that, yeah, like, nurses, I make a decent wage. I know that.
Yeah.
I know that, but it's also, like, make sure you're in it for the people, because ultimately, if you're not, then why are you doing it?
Yeah.
Everyone has their days. I'm like, have days where people are annoying the shit.
Oh, of course.
Work.
Absolutely.
And I'm like, oh, I can't believe I have to spend 12 hours with you. Like, can you just please stop pushing your call bell and leave me alone? I've given you your pain meds. What more do you want from me? But it's very easy.
They just want to see a cute nurse.
Pervy old men, let me tell you.
Okay.
It's a thing.
Oh,
but
is it?
Yeah. Oh,
yeah.
Yeah. I've been, what was a couple years ago, a patient
No, it's
thought
fine. Don't apologize.
I was turning him towards me, and then his hand got really close to downstairs, and I'm like, oh, you can move that stair. He's like, don't worry, little girl, I won't touch your fanny, because he thought I was like 13 years old.
Oh, dear God.
Yeah, but the old ladies are gross too.
Yeah.
Shocking. Like, you'd think, like, oh, but no, they're like, oh, that's a cute guy. Like, you should bring him in. I'm like, no. I'm like, I'll protect you. Don't worry. I'm like, no, he's fine. You don't need him. No, he needs to come and help me. No, he doesn't.
I heard a stat that the highest concentration of STDs is in old folks' homes.
Yeah,
That
I used
wouldn't
to work
surprise
in a
me.
retirement home,
I'm
and
guessing that doesn't surprise
I
you.
walked in. I'm like, I'm gonna close this door.
Well, I mean, it's
turn
super
around.
easy just to walk next door. I mean, to be realistic, you're on your deathbed probably. You know you don't have much time left, which is why you're in a retirement home.
Yeah.
You know, who cares? You're not going to get somebody pregnant.
Not at that age, I hope.
No. Let's hope not.
No. So yeah, just make sure you're in it for the right reasons. Because even as a general surgeon, I see a lot of the surgeons, like, like anything, there's good and bad. There's some people who I would let cut me open and others I don't want you. I've literally told my family and my friends, if you are in town and you need surgery, like now, be like, you are waiting a day because this person is on call there not to touch you.
I have a do not touch list as well.
Exactly.
For my wife.
Yeah, I'm like, no, don't. No one. This person is not operating on you, but they very much like are in it for good reasons, or you're not, and it's just hard to see because they don't take the time to make those relationships with the patients, which is. I always say, like, these patients are in a vulnerable spot. Like, even if they have a bad day and they're like, oh, I'm sorry I'm being so grumpy. And I'm like, I'm not seeing you at your best day.
No, exactly.
Like, even when you're here, like, you don't want to be here. I don't want to be here, but at least I get paid to be here.
Exactly.
You don't. I'm like, mine's at least somewhat worthwhile.
Yeah.
Yours is not. So at least, like, I can joke with them about that. And ultimately, at the end of the day, I just have to realize, even if I don't do all of like my nursing tasks that I'm employed to do, as long as the patient A, doesn't hate me, and B, maybe I've made them smile or I've done something for them that they're like, oh, you know what? Like, I really appreciate you doing that. Like, even like a glass of water, if that makes their day, like, at least I've made them happy for that instant with their water.
That's awesome.
Yeah.
Well, thank you so much for coming in
Not a
studio today,
problem.
Chelsea. It's been an absolute pleasure, absolute treat. Ladies and gentlemen, that was Chelsea Laurin. She is a registered nurse.
Thanks for tuning in. Don't forget to hit that subscribe button and leave a review. It always helps us out here. Tune in next week where we will have Kyle, who acts, sings, and dances. Have you seen him before? Tune in next week to find out. Do you or someone you know have a strange or interesting career? Don't be shy. You may not think it's a weird job, but someone certainly will. So, shoot me an email at eric@cardinalimages.ca. Thanks again for listening. Until next time, I'm E.T. Cheers.